Hello again, my name is Dr. Robert White. I'm a chiropractor with a specialty in functional medicine. I spent the last 5 years and countless hours studying functional endocrinology to be able to deliver the most cutting-edge care in the correction and the prevention of chronic disease. Throughout the course of a day, people would ask me questions about diabetes, and a lot of them ended up being the same questions. So what I did is, basically to make things easier on myself, is I came up with the concept of the Diabetic Minute. This is going to be a simple, ongoing informational series to answer all the questions I've had so far and the new ones, and provide people with the tools and resources to assist them in reversing type 2 diabetes naturally. Actually, this is a question I get all the time is, what should I eat as a diabetic? Right? It's a very broad topic, and I'm going to do my best to give you some clarity in this area. Well, let's start with a little review on how your body actually digests food, and then we'll get into some specifics here. Anytime you eat any type of food, whether it be proteins, fats, or carbohydrates, anything you put in your mouth basically passes down into your digestive tract, and your digestive tract does its little magic trick on it and basically converts everything you eat into sugar. Again, that's not exactly how it happens, but it's pretty close. Now, that sugar stimulates your pancreas to make a hormone called insulin, and that insulin travels with the sugar in the bloodstream pretty much every part of your body. And that's the way your body does, gets the fuel it needs to do everything it needs to do during the course of the day. Now, that insulin that travels along with the sugar, insulin is the key that opens the lock, which is called an insulin receptor, which opens the doorway called the glucose transporter that allows the sugar to go into the cell and be burned as fuel. And you can see the three pictures here. Insulin on the left is actually going to bind with the receptor site in the middle, and in the right, the sugar is actually able to get moved into the cell and be burned as fuel. Now, when all that sugar doesn't necessarily make it into the cell, it hangs out in the blood and ultimately becomes triglycerides. And this is one of the markers we see when people actually are starting to develop insulin resistance. The triglyceride to cholesterol ratio, which is supposed to be about 2 to 1, actually starts to get out of balance. Maybe you have triglycerides of, let's say, 150 and cholesterol of 200. Means that there's some potential problems coming for you. Now, here's how actually insulin resistance starts. On the left, we have a picture of normal insulin metabolism, basically meaning that your insulin's able to open all those doorways and the sugar is able to pass into the cell. But on the right, it's called insulin resistance. What it means is that sugar, not all that sugar makes it into the cell. And the reason it can is because those insulin receptors have become desensitized through years and years and years of abuse. If you went into a loud room when you first walked in, the sound may be overwhelming, but after you've been in there for a while, maybe it doesn't seem quite as loud. Your body becomes sensitized to it. Same thing with insulin, those insulin receptors. You've abused your body, poor dietary choices, lack of exercise for years and years and years, and those receptor sites have been exposed to extra insulin, sort of like that extra noise for long periods of time. They become desensitized. So when you do eat, those doorways don't open and the sugar actually hangs out in the blood, and again, like I said before, it gets turned into triglycerides. So what is the goal? The goal is to decrease the extra sugar in the blood and keep insulin levels low. So how do we do this? Now, I know there's 100 diets out there, so what I'm going to do is try and make it simple. The way to do this is to make low glycemic index food choices. Now, what exactly does that mean? Everybody needs to acquaint themselves with the glycemic index. Just go on Google or any other type of search engine and Google in glycemic index, and you'll actually find dozens of them, actually. Now, what a glycemic index is it's a chart that basically ranks how food, specifically carbohydrates, affect your blood sugar. Now, let's take a look at this little graph here. All right. You're going to see that the bottom is in time, and the side there is in blood sugar levels. If you eat a high glycemic index food, you're going to see that there's a spike. Now, an example of a high glycemic index food would be a piece of candy, or a piece of cake, or something along those lines. You're going to get a spike in blood sugar, and then you're going to get a crash, basically. That's the red line. Now, the orange line is basically a graph of a much lower glycemic index food. An example of that would be, let's say, a vegetable, right? Or let's say beans or some protein. And you'll see that the low glycemic index curve is a lot lower, but it's also a lot longer, meaning that your blood sugar level stays a lot more constant for a longer period of time, and that's the goal when you eat. Now again, the glycemic index ranks foods based on their effect on blood sugar, and what they use for a marker or a bench is they use sugar or white bread, and they rank that as 100. And then what they do is they compare most of the foods to that. Your goal, in my opinion, is to eat foods that are below 55 on the glycemic index. Now, examples of those would be complex carbohydrates such as veggies, beans such as legumes such as beans, nuts, some fruit. Stay away from pineapples and bananas. Those are really high in sugar. Some whole grains. Again, you have to watch some sensitivities there because some people have sensitivities to gluten, but generally some whole grains are okay. Lean protein, chicken, beef, pork, eggs, and also good fats. Those are examples of low glycemic index foods. Now here's an example of a glycemic index, and this one's basically, I got this off the internet. This is ranked in 3 different columns. The one on the left is bad foods, and you can see that glucose there is 100, honey's 87, white rice 72, brown rice 66, raisins 64. These are the foods you're generally going to want to stay away from. In the middle is better choices. Right? You can see a banana is 62 there. That's actually a little high. We said 55. Green peas 51. Grapes 45, apple 39. You can see it's going down, and on the right are some much better choices. Basically beans 36, we have milk there 34, grapefruit 26. So generally you're going to want to stay with foods on the right side of this scale versus the center and the left for the most part. And again, go on the internet, Google this, and you can get a whole, I mean, some of these glycemic indexes are like 30 pages, have every possible food you can eat. Another suggestion I have for everybody is go to a bookstore or go on Amazon and get yourself a low-carb cookbook. Not a no-carb cookbook, but a low-carb cookbook. And low-carb means low glycemic index foods. There's no reason, one of the most challenges I have with my patients is they say, you know what am I going to eat? I mean, I'm used to having a lot of carbohydrates, refined foods in my diet. What am I going to eat? And I give every one of my patients a low-carb cookbook. It's about this thick. And there's hundreds and hundreds of recipes in there. Just because you're eating well doesn't mean you have to eat bad. Now, you're going to be eating differently, and it may take a little period of adjustment to actually get used to that, but it doesn't mean you have to eat bad. When I counsel my patients, what we do is we change their diets to very low glycemic index foods, and we got to really get in there sometimes and dig, because sometimes people have a lot of hidden types of foods that they eat and they think they're okay, when in actuality they're not that good for them. What we also do for a period of time for people is we actually remove a lot of inflammatory foods, possible foods they may have a sensitivity to or an allergy to, and some of these examples might be tomatoes and corn. Gluten's a big one. They estimate at least 25% of America has a sensitivity to gluten, and gluten is part of the wheat kernel. A lot of people are allergic to it. It creates blood sugar issues. We have some advanced testing we actually do in some cases to actually see if there's an issue with these with people. Some people have dairy issues. Caffeine is a big one. All right? Caffeine is a stimulant. It makes your immune system not function properly. Basically what we do is we clean a lot of this stuff out and people see a lot of improvement. All right? Another big one is artificial sweeteners. People say, well, you know, if I can't eat sugar, I'll just have stuff made with Splenda or NutraSweet. First, this stuff is not good for you. Right? Second of all, there's a hormonal response when you eat them. I mean, they're very sweet, most of them. So what I've done is I've actually made an entire video on artificial sweeteners. You can look for that one as well, and I'll go into more depth about those in that video. All right, well, I hope this video was helpful on exactly what to eat. I know I sketched some broad strokes, but basically what we're doing is we're looking for low glycemic index foods. Go on the internet, get yourself a low glycemic index chart. Go to the bookstore, get yourself a book, and it's simple. Just take out the bad foods, put in the good ones. Pretty much as simple as that. If you like this video or like to see more videos like this one, or I actually have a free report on reversing type 2 diabetes naturally, if you'd like to get this, just visit www.thediabeticminute.com. This is Dr. Robert White, and I'll see you soon on the next edition of the Diabetic Minute.